Welcome everyone to today's video, where we will showcase our patients' transformation journeys. So, these are the first two patients in this comparison video who were struggling with hair fall issues. Now, let's take a look at their transformation journeys. Have you ever caught yourself hiding behind a cap on outings, in photos, or even while meeting friends just because your hair doesn't feel like you anymore? Meet our patients who faced the same challenge for years. Patient 1, dealing with Norwood grade 2 baldness for nearly 4 years, discovered us on social media. Daily hair fall while combing and the constant need to wear a cap made socializing uncomfortable. Inspired by our YouTube results, he took the step, and in just 7 months, his look and confidence completely transformed. Patient 2, a video creator facing Norwood grade 3 baldness for over 5 years, felt his receding hairline was making him look older on camera. Caps became a necessity. After seeing our real patient results online, he chose QHT, and within 10 months, his overall look has changed. If you also want to achieve similar results than right now, book a consultation with our experts. In this video, we shared their complete hair transplant journey, from planning and hairline design to progressive hair growth. Watch till the end, and don't forget to subscribe for more real transformations and expert insights. Patient 1, who had an early-stage baldness, primarily marked by a receding hairline. Over time, the position of his hairline had shifted backward from the frontal area, causing an imbalance in his overall facial frame and making the forehead appear broader. The recession had also progressed from the temporal sides, which made the frontal region look sparse from the corners. However, the remaining scalp maintained healthy and uniform hair growth, which meant there was no need for any surgical intervention in those areas. Most importantly, the donor area was healthy and dense, an essential factor for achieving natural and successful hair transplant results. In patient 2's case, the hairline had receded significantly toward the mid-scalp, making the forehead appear noticeably wider. The frontal area had become completely sparse, and this mid-stage baldness had a visible impact on his facial proportions. As a result, his overall appearance began to look dull and aged, and styling his hair became increasingly difficult. Being a content creator, appearance played a crucial role in his professional life. The positive aspect was that the remaining scalp still had healthy hair growth, eliminating the need for any surgical intervention beyond the frontal region. The primary requirement was to restore the frontal hairline and density, which was well supported by his healthy and dense donor area. If your hairline is also receding, you can simply share your pictures with us. Our doctors will help you understand your current stage and guide you towards the best treatment option. Once the detailed scalp assessment was completed, our experts moved on to the next step, which is hairline design. A well-planned hairline is the foundation of natural-looking results, as it directly impacts facial balance and overall appearance. To begin this process, both patients' heads were carefully shaved to clearly visualize the extent and pattern of baldness. The scalp was then thoroughly cleansed using a medicated solution to ensure proper hygiene and prepare the area for precise planning. After this, the hairline was designed. For patient 1, the hairline was planned by keeping his facial proportions in mind and accurately measuring the distance from the glabella point. Along with this, the frontal area was carefully outlined and the temporal angles were precisely marked to restore a well-defined hairline. Since the remaining scalp showed healthy and dense hair growth, no additional markings were required in those areas. For patient 2, the hairline design was approached with equal precision but tailored to his round face shape and facial symmetry. Measurements from the glabella point helped create a soft, natural hairline that complemented his facial structure. Along with this, the affected frontal area was outlined and the small patchy area with absent follicles was also marked separately. These detailed markings provided the surgeons with a clear roadmap of the bald areas and served as essential guidelines during surgery, ensuring accurate graft placement and optimal density. After finalizing the hairline design, our team immediately began the surgical procedure. First, we then administered local anesthesia to ensure the procedure remained completely painless and comfortable throughout. Once the anesthesia took effect, our experts created micro slits in the affected areas of the scalp. They designed each slit with precision, carefully following the patient's natural hair growth, direction, angle, and depth. This step plays a critical role in achieving natural-looking results. Next, our surgeons performed extraction and implantation simultaneously using the advanced QHT technique. This method helps preserve follicle vitality, reduce graft out-of-body time, and significantly improve graft survival. For patient 1, our team implanted single and thin hair follicles in the hairline zone to create a soft and natural appearance. To enhance density and provide a fuller look, they strategically implanted double and triple hair follicles in the frontal area. In this case, a total of 2,500 210 follicles were implanted, all precisely extracted from the patient's safe donor zone without compromising donor density. For patient 2, the team followed a customized approach. They implanted single and thin hair follicles along the hairline to form a smooth, rounded contour that suited his round face shape. To restore balance and volume in the frontal region, they implanted double and triple hair follicles for optimal density. In this case, the surgeons transplanted 3,200 follicles, carefully extracted from the safe donor zone while maintaining long-term donor area integrity. Our team executed every step with precision, expertise, and advanced planning to deliver dense, natural, and long-lasting hair transplant results for both patients. If you want to know more about the procedure, comment hair transplant. After the transplant, both patients visited the clinic multiple times for follow-up sessions. During these visits, our experts closely monitored the healing of the scalp and carefully assessed how the transplanted grafts were responding, ensuring proper recovery and optimal hair growth. At the 1-month follow-up, our experts observed nearly 70% shedding on patient 1's scalp. This shedding indicates that the transplanted follicles have successfully settled into the scalp and entered the resting phase. This stage is essential as it prepares the follicles for stronger and healthier regrowth in the upcoming growth cycle. During this phase, the patient's native hair continued to grow at its natural pace without any disturbance. The donor area showed excellent healing, with the skin fully recovered. Overall, the scalp condition remained healthy, confirming proper graft survival and a smooth post-transplant recovery process. 2 months after the transplant, patient 2 visited the clinic for his first follow-up. During this visit, our experts observed nearly 90% shedding in the transplanted area with mild redness present there, which naturally fades over time as healing progresses. At this stage, the transplanted follicles had successfully entered the resting phase, allowing the roots to strengthen beneath the scalp in preparation for healthy regrowth in the coming months. The patient's native hair follicles continued to grow at their natural pace without any disruption. The donor area has also healed completely without any inflammation. During the first and second month follow-up visits, both patients underwent their first PRP therapy session as part of their post-transplant care plan. This therapy plays a crucial role in stimulating the transplanted and native hair follicles by improving blood circulation to the scalp. Enhanced blood flow helps deliver essential nutrients and growth factors to the follicles, strengthens the roots, and supports faster healing and healthier hair regrowth. If you have any questions regarding the shedding phase or PRP, then drop them in the comments section. Our experts will guide you. 5 months after the transplant, both patient 1 and patient 2 visited the clinic for their next follow-up. During this visit, our experts observed that the shedding phase had fully concluded and the transplanted follicles had successfully transitioned into the active growth phase. At this stage, new hair growth appeared stronger and more mature. The hairline had started taking a well-defined shape, beautifully framing their facial features and restoring overall facial balance. In the frontal area, dense and voluminous hair growth was clearly visible, blending seamlessly with the patient's natural hair and creating a uniform, natural look across the scalp. The overall scalp showed consistent and even hair growth, which significantly enhanced their appearance and confidence. The donor areas had healed completely and became virtually undetectable, with no visible signs of extraction. For both patients, the progress at the 5-month mark appeared remarkably similar, reflecting healthy follicle survival, proper growth direction, and a successful transplant outcome. If you are also ready to bring back your hairline and are looking for the best clinic, then right now, book a consultation with our experts. 7 months after the transplant, patient 1 shared his fully matured hair growth progress. At this stage, the hairline had settled perfectly and now framed his facial features in a natural and balanced way, giving him a noticeably younger and more energetic appearance. The frontal area showed dense and voluminous hair growth, creating a strong and well-defined look that blended seamlessly with his native hair. The overall scalp appeared full and healthy, with uniform hair growth and improved texture. With the restoration complete, patient 1 can now style his hair freely and choose any haircut according to his preference, further enhancing his overall appearance and confidence. 8 months after the transplant, patient 2 confidently went for his first haircut of choice, marking a significant milestone in his hair restoration journey. By this stage, the transplanted hair had grown to sufficient length and strength, allowing him to style his hair freely. The texture and thickness of the hair had improved noticeably, and the overall growth blended naturally with his existing hair, clear proof that the follicles had matured successfully. At the 10-month mark, patient 2 visited the clinic for his scheduled PRP session. This time, he walked in with a completely new hairstyle, reflecting both his restored hairline and renewed confidence. The hairline appeared perfectly defined, soft, and natural, providing excellent facial framing and enhancing his overall appearance. The frontal area showed impressive density and volume, while the rest of the scalp appeared fuller and evenly covered. The hair growth looked healthy, strong, and well settled, with no visible gaps or patchiness. This stage highlighted a balanced combination of natural hair direction, proper density, and long-term graft survival, showcasing a successful transformation for patient 2. Patient 1 initially had early-stage baldness with a receding hairline that disrupted his facial balance and made the forehead appear broader. 7 months after the transplant, his hairline became well-defined and natural. The frontal area gained dense growth, and his overall appearance looked younger, fuller, and more confident. Patient 2 initially had mid-stage baldness with a significantly receded hairline and sparse frontal area, making his forehead appear wider and his look aged. 10 months after the transplant, his hairline became perfectly defined. The frontal area gained strong density, and his overall appearance looked fuller, balanced, and youthful. Both patients achieved highly impressive results despite starting at different stages of baldness. In both cases, the hairlines appeared natural and well-defined. The frontal areas gained excellent density, and the transplanted hair blended seamlessly with the native hair. At the 7 and 10 month marks, both achieved outstanding results that will continue to improve naturally for a lifetime. If you also want the impressive results with painless surgery experience, then right now, book your slot. Give a call or drop a message, our team will reach you out. Or visit any of our branch.
मॉडल कॉलोनी हरिद्वार, D15, आउटर रिंग रोड, प्रशांत विहार, सेक्टर 14, रोहिणी, दिल्ली। नर्सिंग होम प्लॉट संख्या 3, सेक्टर 46, गुरुग्राम, हरियाणा। ऑपोजिट होटल पार्क हयात, रोड नंबर 2, बंजारा हिल्स, हैदराबाद, तेलंगाना।
You have just seen the transformation journeys of our previous patients. Now, let's meet our next patient who was struggling with hair fall issues. Let's hear about his journey in his own words.
Hair loss is not just about losing hair. It is about slowly losing confidence, identity, and sometimes even peace of mind. In today's video, our patient
My name is Dr. Kiran. I'm 38 years old and I'm a doctor by profession.
shares more than just his surgery experience. He shares the emotional journey that led him to make that decision.
But the story, it was like 2021. The frontal part, जो सामने का head was same. It was normal. I feel that way.
At first, he believed new strands were growing, but with time, he realized it was not growth. It was gradual hair fall. He has a naturally high forehead because,
Yes, my father is also bald and my brother next to me.
but from 2021 to 2023, the thinning became clearly visible. He did not use any specific hair growth treatments.
And other than that, I was not trying enough until I got that some of my friends were going for some hair transplant, and I also have some intention for going for it.
In this video, he openly shares his mindset before surgery and his complete experience on the day of the procedure. Honest, real, and from the heart. Let's start.
My name is Dr. Kiran. I'm 38 years old and I'm a doctor by profession. Okay, my hair fall started I think a few years back, and it was around 2021 when I started noticing some thinning in the upper part of my head. Initially, I was not noticing it. I was thinking that new strands of the hair were growing when I filled it, and then slowly I come to know that it was the sign of the hair fall, and I have a very high forehead, and I thought that it was just a natural process. And then yes, my father is also bald and my brother next to me, and he also have a high forehead. So I was thinking in that way, and I was not paying that much attention. And in the subsequent years from 2021, 22, and 23, I could see the visible hair thinning over the top of my head, and I didn't use any kind of the hair product so as to increase the hair growth so far, except for some anti-dandruff shampoos and some hair oil. And other than that, I was not trying enough until I got that some of my friends were going for some hair transplant, and I also have some intention for going for it. And that before that, till now, I am not using, except for some multivitamins and all those things, I'm not using any particular product for boosting my hair growth. As you can see, I have a N-shaped hairline. Earlier it was up to here, but the story, it was like 2021. The frontal part, जो सामने का head was same. It was normal. I feel that way. But thinning mostly started from here. This part which I couldn't see. Mirror के सामने मैं देख नहीं पाता था, तो ज़्यादातर सब लोग कहते थे कि even in my office का staff बोलते थे कि सर आपका हेयर थोड़ा थिन होता जा रहा है, बट आई वॉज नॉट पेइंग दैट मच अटेंशन. बट वंस ये धीरे धीरे होकर ये जो साइड का जो है वो पीछे जाने लगे। देन आई कम टू रियलाइज कि ये थिनिंग इज हैपनिंग। तो इन कुछ 4-5 सालों में धीरे धीरे करके इस मुकाम तक मैं पहुंच चुका हूँ। Presently what I am feeling right now is that whenever I go to any kind of the ceremony or function or any public gathering, I'm becoming more conscious. If somebody is looking from backward, then maybe they could see the thinning portion of my head or my hair. So ये जो confidence है वो थोड़ा down हो चुका है, and then because of which right now I'm just thinking that I should give hair transplant a try. And moreover मुझे hair page के बारे में भी मैंने सोचा था, but I don't like hair page. तो it's a personal choice and option. मैं hair transplant को ही ज़्यादा पसंद करता हूँ, because hair page का वो सब लगाना और फिर उसको निकालना and then associated hair infection, तो जो कुछ भी which I am perceiving मुझे वो अच्छा नहीं लगा, तो फिर hair transplant के बारे में सोच रहा हूँ। अभी तो गूगल भी है, तो आप बहुत सारे ऐसे इंफॉर्मेशन सर्च कर सकते हैं। मैंने भी थोड़ी बहुत रिसर्च किए थे और मैंने थोड़ा बहुत कुछ दवाई थोड़ा कुछ ट्राई किया था, हेयर ऑयल भी थोड़ा ट्राई किया था, इट वाज नॉट वर्किंग। एंड देन हेयर बेज का तो मेरा एक पर्सनल ओपिनियन है कि वो मुझे आई डोंट फील it looks too fake, which doesn't identify with me. But now I have reached to this stage where I think the hair transplant is the better option for me. And I also have consulted and talked to some of my friends who have successfully undergone a hair transplant, and I'm also inspired by them. And many of my colleagues also have undergone hair transplant, and by seeing the results, I'm also thinking about giving it a try. मैंने भी थोड़े बहुत किए हैं उसके बारे में रिसर्च, और उसी हिसाब से मैं दिल्ली भी आया। मेरा एक दोस्त है यहाँ पर, तो उसके थ्रू मैं कुछ ऐसे हेयर ट्रांसप्लांट क्लिनिक में भी गया, और फिर उसका कॉस्ट वगैरह वो सब के बारे में भी मैंने पूछा कि कॉस्ट कितना है एंड उसका रिजल्ट कैसा होता है एंड ऑल दोस थिंग्स। तो 1-2 जगह मैंने सर्च भी किए थे। उसके बाद फाइनली मैंने एक ये क्लिनिक के बारे में सुना, एंड कॉस्ट वाइज भी इट इज़ समथिंग, आई थिंक इट इज़ मोर ऑन अफोर्डेबल साइड, एंड द सर्विसेज एंड द स्टाफ का जो कोऑपरेशन, एंड देन फ्रीक्वेंट कॉल्स एंड आस्किंग यू अबाउट दी व्हाट आर द थिंग्स दैट यू शुड डू एंड यू शुड नॉट डू, ऑल द थिंग्स कुल मिलाकर मैंने जब देखा तो ये बहुत ही अच्छा हेयर क्लिनिक मुझे लग रहा था। तो फिर मैंने QHT को मैंने कॉन्टेक्ट किया और फिर वहाँ पर गया। मैं गया था दिल्ली के उसके ब्रांच में। फिर उन लोगों ने मेरा हेयर का कंडीशंस देखा और फिर डॉक्टर से बात हुई, और उसने कहा कि मेरे स्टेज के अनुसार दे हैव सजेस्टेड अराउंड 4,500 grafts will be required for my hair transplant, and they also have told everything ki what are the step and what are the process that through which I have to go through, everything in detail, starting from the what are the pre-surgery का process कैसा रहेगा, सर्जरी में आप क्या क्या करेंगे, the post surgery, what are the precaution and the care that you should take for everything, and even the course also, everything is explained beforehand, so that तो अभी तक मेरा जर्नी QHT के साथ it's going on very fine, it's going on very great, and they have explained everything about the hair transplant, the process and the procedures, and what are the necessary care and I should take regarding the food habits, and what are the medicines should I be taking, and when should I stop, all those things. So of course they had explained it to me very clearly, so I think it is one of the best hair transplant providing clinic, and and also taking all these things from the feedback that। और मैं आज आया हूँ हरिद्वार की QHT क्लिनिक में, और यहाँ पर आते ही मैंने मेरा सब कुछ ब्लड टेस्ट का जो कुछ भी रिपोर्ट है मैंने जमा किया, एंड देन दे हैव चेक ऑल माई रिपोर्ट्स, and then I also have talked to the anesthetist that the कल का प्रोसीजर कैसा रहेगा, that कितने इंजेक्शन आपको लगाए जाएंगे, and then उसके बाद they also have done the drug sensitivity test कि कल अगर इंजेक्शन लगाएंगे इसमें आपका रिएक्शन कैसा होगा, whether you will be fit or not, वो सब देख चुके हैं। उसके बाद they also have taken the photos from the different angles कि मेरा अभी ईयर का कंडीशन कैसा है, और फिर उसने बताया है कि मेरा आज हेयरलाइन कहाँ से कहाँ तक होगा, और फिर उसके बाद कल मेरा सर्जरी होगा, एंड आई एम ऑल्सो वेरी नर्वस एट द सेम टाइम वेरी एक्साइटेड दैट मेरा लुक कैसा होगा एंड ऑल द थिंग्स। सो आई थिंक आई एम वेरी लुकिंग फॉरवर्ड टू दिस होल प्रोसेस, एंड आई होप एवरीथिंग विल बी great। तो सर्जरी का जो कुछ भी प्रोसेस होगा आई विल कीप ऑन अपडेटिंग विद यू गाइस, स्टे ट्यून टू माय वीडियोस। थैंक यू। हाय, माय नेम इज़ डॉक्टर युमनाम किरण मैते। आई एम 38 ईयर्स ओल्ड और आप देख सकते हैं कि आज मैंने मेरा हेयर ट्रांसप्लांट किया है। यू कैन सी इट हियर। द सर्जरी स्टार्टेड from around 8 a.m. and it goes up to 5:30. So, and the overall experience that I received from the surgery is I was early intimated that कि सर्जरी कब मुझे यहाँ पर कितने बजे पहुँचना है एंड सभी स्टाफ ने मुझे अच्छी तरह से ग्रीट किया और फिर मुझे ओटी रूम में लेकर गए एंड द नर्सेज एंड द टेक्नीशियंस एंड द डॉक्टर्स दे आर ऑल वेरी कोऑपरेटिव और सबसे ज़्यादा मुझे डर इसका था कि बिकॉज ऑफ द पेन कि कितना दर्द होगा इस सर्जरी के दौरान, पर मुझे लोकल एनेस्थीसिया दिए गए और फिर बीच बीच में वो लोग बोलते गए कि अगर आपको थोड़ी सी भी दर्द हो तो आप बता सकते हैं करके। सो एवरी टाइम आई हैव अ लिटिल अमाउंट ऑफ पेन एंड अ लिटिल अमाउंट ऑफ डिस्कम्फर्ट, आई जस्ट इंटिमेटेड देम, आई टॉक टू देम एंड आई गिव देम अ सिग्नल। तो फिर वो थ्रू हेल्प ऑफ द डॉक्टर्स एंड टेक्नीशियन वो हेल्प करते थे एंड दी इतना मुझे डर था कि ये सर्जरी को लेकर कि इट माइट बी पेनफुल, इवन दो आई हैव टॉक विद अ lot of my friends who already have gone through the surgery. They said that it's a bearable pain. So the same thing happened with me also. So I think anyone who have a thought about कि इसमें ज़्यादा दर्द होगा वो उतना ज़्यादा नहीं है and it is bearable and it is tolerable and they also have in every possible way so that the surgery goes successfully. And you can see here I am. And as far as the environment of the OT room is concerned, the room is very clean, very hygienic, and all the nurses and all the technicians and the doctors, they're all very cooperative. They keep on asking what, and if there is any kind of discomfort that you have, they keep on asking and they are already ready to help you in any possible way. And even before the procedures and in between the procedures and after the procedures also, they provide you a light snacks and a meal, and in between if you have any discomfort then they are already there. They keep on asking and even you are also allowed to say whatever discomfort or any kind of the problems if you have, you can easily communicate with them. And they are, especially I like the nurses, they are so good and they are so very much enthusiastic in their work and yeah, kudos to them. And yes, definitely the technicians and the doctors too. So the overall experience here at the QHT clinic regarding my hair transplant is a very well organized, a very smooth going and overall experience जो कुछ भी मेरा रहा है बहुत ही अच्छा रहा है। और फिर मैं चाहता हूँ कि अगर आप लोगों कोई जिसको हेयर ट्रांसप्लांट करवाना है QHT से हेयर ट्रांसप्लांट करवा सकते हैं, जैसे मेरी तरह और मेरे दोस्तों ने भी किया था, उन लोगों ने मुझे बताया और फिर मैं यहाँ पर खुद अपने आप एक्सपीरियंस किया हूँ। तो इट्स अ वेरी नाइस एक्सपीरियंस एंड आई थिंक यू कैन ऑल्सो दोज हु आर इंटेंडेड टू डू हेयर ट्रांसप्लांट यू कैन विजिट QHT सेंटर। और फिर सर्जरी से पहले क्या क्या करना है और सर्जरी के दौरान, सर्जरी के दिन में मुझे कैसे अपैरल पहन कर आना है वो सब, और फिर सर्जरी के बाद जितना भी प्रिकॉशन मुझे लेना है जैसे कि क्या खाना है क्या नहीं करना है एंड देन वो सब पूरे विस्तार से बताया गया है। और फिर बहुत सारे ऐसे दवाइयाँ और किट्स भी हमें दी गई हैं ताकि जब हम घर से आ सकें, घर जाएँ तो फिर हम अपने आप को भी देखभाल कर सकें, ऊपर से हम अपने घर वालों को भी बता सकें कि मुझे इस तरह से करना है। तो फिर दे आर ऑल्सो सो दैट दे कुड ऑल्सो हेल्प अस एंड एट द सेम टाइम आई ऑल्सो कैन टेक केयर ऑफ माई सेल्फ। एंड ऊपर से कितने दिन के बाद मुझे यहाँ पर आकर दोबारा मेरा हेयर वॉश वगैरह वो सब करना है वो भी बहुत अच्छी तरह से बताया गया है ऊपर से। और उन लोगों ने भी ये बताया कि हम अपने आप भी कर सकते हैं प्रोवाइडेड इफ़ वी फॉलो द रूल्स ऑन द प्रिकॉशंस दैट दे टोल्ड अस। और आप ये देख सकते हैं ये है मेरे ग्राफ्टेड एरिया और नीचे आप जो देख सकते हैं ये है मेरे डोनर एरिया। आई वॉज वेरी स्केयर नर्वस बिफोर कि कैसा रहेगा इतना सारा ग्राफ लेना है मुझसे करके, बट एट द एंड ऑफ द डे इट वॉज अ वेरी हैप्पी जर्नी फॉर मी एंड आई होप दोज हु वांट टू अंडरगो द हेयर ट्रांसप्लांट इट विल बी द सेम जर्नी फॉर यू टू ऑल्सो। और जो टेक्निक जो मेरे हेयर ट्रांसप्लांट में जो इस्तेमाल किया गया है ये QHT टेक्निक है। और इस टेक्निक में क्या करते हैं कि हम ग्राफ को उसी दिन निकालते हैं एंड ऑन द सेम डे हम ये रिसिपिएंट एरिया में हम उसको ग्राफ को लगाते हैं। तो इससे क्या होता है कि ग्राफ का जो सक्सेसफुल रेट, द चांसेस फॉर द ग्राफ टू सर्वाइव इट्स मोर देन 90%। So I think this is one of the very good technique, and I think because of this technique also I have opted for the QHT हेयर ट्रांसप्लांट। और आप देख सकते हैं कि आई हैव जस्ट कम आउट फ्रॉम द ओटी एंड आई एम रिकॉर्डिंग दिस वीडियो एंड यू कैन सी इवन माय ग्राफ्स एंड माय डोनर एरिया इज द wound are all fresh, but still right now I'm very active and I'm very healthy. So I think you should opt for QHT. It is one of the best techniques I think anyone can go for as far as the hair transplant is concerned. और आप देख सकते हैं कि पहले जो मेरा लुक था और सर्जरी के बाद जब मैंने अपने आप को शीशे के सामने देखा, so I feel so confident and when I see my hairline and I feel so good and so happy. So in the subsequent visit, when I come for the hairdressing and for hair wash, I will keep on updating the journey of my hair transplant, the growth, and I think all of you should keep tuned to see the process of my hair transplant. Thank you, and share this video and keep liking this video. Thank you.
Hello friends, if you have not subscribed to our channel yet, please like this video, share and subscribe to our channel, and don't forget to hit the bell icon so that you will get update on every video.